Welcome. Thank you for joining us for our Allies in Action, advocating for biomarker testing. I'm Kim Newcomer, the Director of Volunteers at the Alliance.
And hi, I'm Jamie Telford. I'm the Director of Industry Giving at the Alliance, and we are excited to work with all of you, including partners from across the country, to advocate and increase access to biomarker testing.
So, what is biomarker testing? Now, biomarker testing is the latest advancement in cancer research that is personal to the patient and their cancer, helping ensure patients get the right treatment at the right time. Biomarker testing also allows doctors to precisely target cancer so patients may not have to undergo more generalized treatments like chemo and radiation that might not work well for them. However, many insurance companies aren't covering this game changing testing for everyone who needs it, leaving it unaffordable for many patients. Now, 66% of doctors who treat cancer report that insurance coverage is a barrier to utilizing this groundbreaking technology.
Hi, it's Jamie again. I just wanted to touch base on sort of our current state of biomarker testing and coverage. We will be digging in on an upcoming training with some key legislative advocates to, again, address more in detail what types of coverage exist and what kind of the other coverage options are. We will also be providing you the links to those resources for your research, for your own education, making sure not only do you have information around what currently is covered through the current cancer guidelines, even on like a federal level, but also, what are the different options that we have been seeing across various states in an effort to increase comprehensive biomarker testing coverage. So currently, all payers will cover some biomarker testing for specific NCCN recommended biomarkers for stage 3 and 4 patients. So there is a larger coverage determination that where biomarker testing is underway. It may depend on the type of test that's given and making sure that it complies with the current coverage guidelines for the specific recommended biomarkers to be tested. But the movement here, a state by state movement, is really around comprehensive biomarker testing. We know it's incredibly important to make sure for biomarkers that currently have approved therapies that patients be tested so they know those therapies are available to them in treatment. But we also know that with the advancement of clinical trials, the accelerated detection of new biomarkers in colorectal cancer and other cancers, that certainly patients should need to know their full comprehensive biomarker profile or genomic profile in order to understand all the treatment options or clinical trials that might be available. But first, that coverage is needed to cover these comprehensive tests that are incredibly expensive. And so you will see a variety of different types of legislation underway. So really aggressive, powerful, full coverage for private payers, for Medicaid individuals, et cetera. You will see partial coverage plans that are underway in certain states. So maybe it'll be available to a certain percentage of patients who are covered under private insurance, but maybe not Medicaid. And that's where the Alliance and our other advocacy partners will be helpful in making sure you have the resources, tools available so you know what is happening in your state, what the key areas or key talking points to advocate for, and also where we might want to advocate for more coverage depending on the state. Right, because our really goal here is this comprehensive biomarker testing, or you'll see it listed as genomic testing for cancer patients to receive this test. There is a growing number of payers who are providing coverage for sort of the standard tests that are recommended, and maybe even slightly more comprehensive tests. So testing for additional genes and things like that. But we do know across the board that coverage is limited. And that is where the Alliance, along with many other advocacy partners across the country and organizations, are trying to move the needle on a state level. And then hopefully that groundswell can create a larger federal level as well. So there are different types of legislations underway between sort of a fuller comprehensive coverage. We're going to cover this full sort of, they call it gene panel, full biomarker panel for all patients who have insurance or qualify under any state approved plans, federal approved insurance plans. Or there might be sort of a slightly less comprehensive. It's still covering most of the biomarkers, but maybe for a certain percentage of the population in a state. Certainly, we want it to be fully covered. So those details we will help you navigate. We will arm you with the right information. We will make sure that you have a better understanding of what is happening on a state-by-state basis. I do encourage you with questions to reach out to Kim following this training, and there will be a cadence of trainings moving forward. This is just the first of many conversations. We really want to kick this off. We know the summer can be a little slower legislatively in states, but we want to start to build those resources and make sure our allies, and many of you may already be participating in this effort through ACS CAN or other organizations, but we really want to start to make sure that our resources are available, you feel empowered and have the knowledge of what is happening in your home state, or if it's not happening, how you can maybe create activity in your state. And also as we move into newer legislative sessions, that we are empowered, we have the resources that we need, and that we can create movement where we live with our partners across the cancer community. So again, we may not have, we're going to do our best to answer questions tonight. I'm not a scientist. I'm a little bit of a policy nerd, but we'll make sure as these trainings move forward, you have access, of course, to the experts, to people who can provide really important insights, and just make sure that our entire community is working together to advance the cause for advocating for biomarker testing coverage and really making sure that access gets approved on a state-by-state basis. I think Kim is going to be up next with some additional information, and we also have a great video shortly to share around why this is so important for patients and families.
All right, now we're going to watch a small video of biomarker testing, unlocking the personal treatments to improve patient outcomes.
Imagine, scientists have developed a new way to use information from your own genes or proteins to help doctors diagnose or treat disease and improve survival and quality of life in conditions like cancer. Well, biomarker testing is here, and it's full of promise. Now imagine this. Thousands of Americans who could benefit from this scientific advancement missing out because of lack of insurance coverage and other barriers. Americans who have been marginalized, including in communities of color and those who are insured through Medicaid, and people in rural communities far from academic medical centers, are less likely to benefit from these life-saving advances. A biomarker is a unique signal that is specific to a patient's disease and can be measured in blood or tissue. In cancer, biomarkers can include molecules like proteins and gene mutations found in cancerous cells. Cancer biomarkers are often notated by an abbreviation which can include numbers and letters. A positive test means the patient's cancer cells have that biomarker, and this information can be used to select the most appropriate treatment. Scientists are working to advance new treatments for cancer and other diseases by determining what biomarkers can convey about the effectiveness of different therapies. Currently, there are rapidly increasing numbers of biomarker-informed therapies doctors are using, and these therapies are leading to improved survival rates and better quality of life for people with cancer, and those better health outcomes could lead to lower healthcare costs. But private and public insurance plans are failing to keep pace with this progress. As biomarker-informed care continues to advance, ensuring equitable access to biomarker testing by improving coverage will be key to preventing new health disparities and dismantling barriers that prevent too many patients from benefiting from these innovations. So even if you're not a doctor or a scientist, you can help bring the promise of biomarker testing to all Americans who need it by supporting a law to extend coverage for biomarker testing and by educating friends, family, and policymakers about the importance of biomarker testing. Join ACS CAN in supporting policies that will ensure coverage of testing for patients, including those insured through Medicaid. Improving access to biomarker testing can lead to better patient outcomes and advance health equity for all.
All right, now for the fun part. So we've created this toolkit for you and a one-pager. Everyone will receive this one-pager with links and material. It will help us expand comprehensive biomarker testing in your state. With just a few clicks, you'll be able to activate and reach out to your local legislators. So how do you begin? So let's get started. You'll go to Find Your Legislator. So I'm going to go to that page now. I'm going to exit this. When you click on that link, it'll bring up Find Your Legislator. And there are just a few easy steps to this. So you can enter your email, and your zip code, and enter your information. And your street address. And hit continue. And then you're going to pick all of your state officials. You're just going to highlight them, click on the little box. We make this super easy. And then we're going to go to compose email. So we've even made this easy for you too. So on that other page, I'm going to minimize this window really quick. We're going to go to our template, our biomarker template. So we are going to highlight this template, hit copy, and then we're going to go back to Find Your Legislator. We'll make this large again. We're going to pop this in here and paste it. Now you're going to want to go up in here and pick your state. So you're going to take out where it says state name, and I'm going to put Wisconsin for mine. And then at the bottom, I'm going to put thank you and my name. I know how to spell my own name, I promise, Kim Newcomer. And then I'm going to put biomarker testing. And then I'm going to hit send message. And then you'll get a confirmation that your voice has been heard and that you've communicated with the following people below, which is really awesome. Now, sometimes don't panic if you get a message that said they may check to make sure it's you. They'll send you an email with a code. You have to put the code in to send it. So now what happens? We've done the letter we want, you submitted it. Next step is to report to us if you have submitted. So that's really easy. In your one pager, there's a link to Allies in Action. It'll link out to this page. Just your first, last name, your email, street address, and your city, and the states you've done outreach in. And then just hit submit. It's as easy as that. It's as easy as that to make a difference in testing for biomarker legislation. So we hope you will all join us and make a difference and submit to your state. All right. Thank you again for joining our Allies in Action training today. You can help expand insurance coverage of comprehensive biomarker cancer testing in your state by contacting your state legislation today. Thank you to Jamie for joining me today, and a big thank you to our allies for helping us with such an important issue. You can always visit our Allies in Action webpage or contact me, knewcomer@ccalliance.org. Thank you again, and thanks for being an ally in action.